I'm really excited to be here today because I am going to be interviewing Dr. Nick Lowe, who's one of the top dermatologists in the UK and has a very long waiting list. So watch out for more. Nick, is it true that you need to wait 3 years to get an appointment with you?
Not quite 3 years, but it's the old problem. There are not enough dermatologists in the UK.
So I want to talk to you about fillers and get your point of view on the industry. What are the new advances in fillers that we see today?
Well, I think there's too many developments in Europe in fillers. I think we need to step back a bit and we need to start using the ones that we know that are safe and that are reasonably long lasting but not permanent.
So which ones do you trust?
The best ones are the ones, in my opinion, that are approved also in the United States. They are approved there by the Food and Drug Administration and they make them do really long-term studies. So there's about 8 that are approved in the United States that I use also in London. There's the Juvederm series, which is Juvederm 2, Juvederm 3, Juvederm 4 and Juvederm Voluma. I'll also sometimes use the Restylane Perlane Sub-Q, but I've generally gone away from those simply because for a long time they didn't have, like Juvederm has, local anaesthetic mixed. I think that's the big advance. If you talk to people that have had it with or without local anaesthetic, they'll choose the Juvederm with the local anaesthetic any time.
So is there a big difference between Juvederm and Restylane?
Well, there are, because in fact they're made differently and Juvederm relies on its different thicknesses. It depends on the degree of what we call cross-linking between the hyaluronic acid molecules. Whereas with Restylane, it's the size, or the size, if you will, of the clumps of hyaluronic acid. And I don't think that Restylane gives quite the same smoothness as Juvederm. But having said that, there are people who prefer Restylane and there are people that prefer Juvederm. I just happen to prefer Juvederm, as I say, because it was the first one that came out with a good local anaesthetic. The other things that are approved in both countries is things like Sculptra, which isn't really, it shouldn't be called a filler. It's an injectable that I use in this area only for people with thin faces, early sagging, hollow scars. And what that is, it's an agent called polymerized lactic acid. It dissolves once it's injected and it stimulates the skin's cells to produce more collagen. So that's approved in both countries. Radiesse is approved in both countries. So I will sometimes use Radiesse. And those are the main ones that I will restrict myself to. I tend not to use collagen now, although that is one that's approved in both countries, mainly because of the increased risk of allergy. There's a 3% risk of allergy from bovine collagen, which is still used a lot, Zyderm, Zyplast. There's virtually 1 in 2,000, 1 in 3,000 risk with the Juvederm and Restylane fillers.
So at what age should one consider starting fillers? Can you be too young?
Well, I think if you've got some really bad post-acne scarring in the 20-year-old, that is entirely appropriate because they're often extremely emotionally distressed, depressed by their facial scarring. I think fillers in that situation are absolutely to be allowed, to be encouraged actually. In addition, I think if you've got a severe scar where we can help with some of the fillers. I think if you've got some significant facial asymmetry, if you've got a very deep fold on one side, maybe from a nerve palsy, often the combination of botulinum toxin plus fillers, even in the youngster, can be very helpful and often much less traumatic than plastic surgery. I would say that the majority of people don't need fillers until their 30s, early 30s, unless, I mean, there are some, particularly women who have very, very thin, naturally, they've got thin lips, and they're often extremely embarrassed by that. So again, if you've got that problem, then I would consider doing the fillers at an earlier age. Let's
talk about nasolabial fills, because I know you're going to be demonstrating that on our case study later. A lot of youthful people have these natural lines, you know, in their teenage years, don't they? Mm-hmm. When do they become aging lines?
I think they make the face look a little more advanced in aging when they are there at rest and when they're getting deeper, and particularly when they extend down into the marionette lines, because it makes the lips turn down, it makes the face look sad, and it just gives this drawn look to the face. So I think those are the times when a filler will be very helpful. Everyone, when they smile, when they move, they're going to increase these, the depth of these lines. That's natural. It's when that they're there at rest that I think you can do something about them.
We see so many celebrities out there who've clearly had too much of a good thing and are so plumped up and over-volumized, and it's just not a good look. How do you ensure you avoid it?
Well, you avoid it by not insisting that you have too much filler.
So you're saying it's the patients?
It's not only the patient. No, it's not only the patient. It's both the patient and some of the injectors. So the injectors can get carried away by injecting too much, and then the patient fails to recognize this and thinks, oh my God, it's going away, we need more. Now, it is, and the sad thing is that when you get those over-injected patients, over what I call volumized patients, they all look like clones. So they've lost their character. So to my mind, the best approach is, so you've got a natural look that looks normal but improved on what you were, that doesn't make you lose your characteristics on your face, and it makes you look as good as you can at whatever age you are. And if you do the fillers subtly, and if you do the botulinum toxins subtly, you'll get that. And in fact, if you combine it with, I mean, one of my favorite slides is a slide that I use on my lecture on combination treatments for the aging face. And this is a lady that's had botulinum toxin here, she's had Sculptra here to give some lifting, she's had Voluma here, she's had some lip filler, and she's had the Fraxel laser to improve the skin quality. And if you look at her before and after, you think that she's had actually major lift plastic surgery, which she hasn't. So you can achieve a lot by selectively combining these treatments.
So you're basically saying technology's evolved to such an extent that is plastic surgery on the way out?
Well, one meeting that I've just come back to in the States predicted that, and went so far as predicted that conventional plastic surgery as we know it now will not exist in the next decade, at the end of the next decade. You'll always need it for scarring, you'll always need it for breast reconstruction, you'll always need it for that type of problem. You'll need it for probably severe eye bags. But a lot of the plastic surgery that has been done in the past will not be needed. And if you talk to the plastic surgeons, the biggest growth in their clinics, certainly in California, is the non-surgical measures that we've looked at today.
And what about cost? How much would a treatment of fillers set you back?
Karen will need fillers here, which will cost approximately £670.
And what are your thoughts on topical collagen? Because there's so many creams out there that claim to really boost the collagen in your skin. I mean, do they really work, honestly?
You're absolutely correct. It does not work. And there isn't any scientific proof that it works. The closest that you can come to it is to temporarily plump up the outer skin with things like hyaluronic acid or glycerine, which are humectants. And they bring in moisture, keep moisture in the skin, which plumps it. And there are some Botox-like chemicals that we call peptides that can temporarily tighten the skin that will last usually for 12 hours. So if you can use those repetitively, you'll improve the skin surface. I have yet to see firm proof that it does anything to form new collagen.